Like humans, dogs and cats may have diabetes. But if well treated, they can live a long and happy life. Diabetes is caused by a persistent high concentration of glucose in the blood. The increase in glucose concentration builds up progressively over time. Once blood glucose has reached a certain level, called the renal threshold, glucose starts spilling into the urine. This is the time for overt diabetes when the symptoms become apparent. In human medicine, diabetic patients are taught by their physician to measure their blood glucose several times a day. Individually, they calculate their needs in insulin according to their glycemia, to the amount of carbohydrates they have ingested, and to the level of their physical activity. Of course, in veterinary medicine, such a flexible treatment strategy is not possible. A dog or a cat may not accept the manipulation needed so often for blood sampling, in addition to the insulin injections. Moreover, pet owners usually have neither the time nor the opportunity to gather the information needed to calculate daily the insulin dose adjustments. Therefore, the veterinarian will set up a very strict protocol. It will include 1 or 2 insulin injections to be given at very precise times of the day, a special diet also to be given at specific hours, and some physical activity. He will ask the owner to monitor regularly blood glucose, weight changes, and actual food intake. The owner will also have to note all the symptoms because they indicate the response of the pet to the treatment. The owner will provide these data to the veterinarian before the next consultation so that he can modify the treatment if needed. In the end, taking care of a diabetic pet represents a consistent effort that requires good organization and a lot of commitment. It will prevent the owner from the risk of making mistakes that may worsen the pet condition, such as forgetting to give food or to inject insulin on time, or giving wrong or imprecise information to her vet that could lead to an inappropriate prescription. Diabetes Pet Manager iPhone app will help you organize the care of your diabetic dog or cat and to provide your vet with quality information. With Diabetes Pet Manager, you will program the times of day when the dog or the cat needs to be taken care of. At these predefined times, the application pushes an audio and visual warning. The app reminds you of the amount of food to be given and of the dose of insulin to be injected. From once a week to once every 2 months, you will have to perform a series of blood sampling and to measure glucose for plotting the blood glucose curve. Diabetes Pet Manager organizes the sequence of actions by warning you on when to take blood and by recording the results. The data and the curve can be sent directly to your vet by a simple touch on the screen. Diabetes Pet Manager proposes a list of diabetic symptoms that you can select and save. In case of hypoglycemic symptoms, the app gives you the opportunity to contact your vet directly or a veterinary emergency service. As a complement, Diabetes Pet Manager records on a daily basis the proportion of the food your pet has actually eaten, as well as the evolution of its weight. At any time, you will have the opportunity to phone your vet or to send him an email including all the information you will have previously entered. Get the last version of the app on the App Store or consult our information website.